Back pain because of spondylolisthesis is very common. Spondylolisthesis means when one bone is slipping forward over the other bone. So this normally happens with age. So this is known as degenerative spondylolisthesis. With age, the disc space reduces and there is a slippage of the bone. So along with the slippage of the bone, there is some pressure over the nerves also that can lead to pain in the legs. So normally spondylolisthesis happens in the lower back or the lumbar spine region. What happens with spondylolisthesis? The bone slips forward, because of which there is a back pain. So majority of the patients, they present to us with back pain, and if there is a pressure on the nerve, then there are symptoms in the legs also. Symptoms in the legs might range from numbness, tingling to cramps while walking, or it can be frank pain or paralysis also. Rarely we can have urine or motion related symptoms also because of spondylolisthesis. So if there is a spondylolisthesis of the old age, which is known as the degenerative spondylolisthesis, then the symptoms could be back pain along with leg pains, mainly in the form of claudication. However, in young patients also spondylolisthesis can happen, and it happens when there is a break in the bone, which is known as the pars defect or the spondylolysis thing. So when there is spondylolysis or defect in the pars, the bone starts slipping forward. This is known as lytic spondylolisthesis. So whenever there is lytic spondylolisthesis, there is back pain, and it can also cause nerve-related symptoms. Now spondylolisthesis basically is graded like 1, 2, 3, 4. 1 is when the slip is less than 25%, 2 is when it is between 25 to 50%, 3 is between 50 to 75%, and 4 is between 75 to 100%. Sometimes the bone topples forward completely, then it is known as spondyloptosis. So if you are having spondylolisthesis in the back, it might require surgery if the symptoms are severe. So if a surgery is required, normally the surgery is in the form of spinal decompression and fixation surgery with fusion. In this surgery, we stabilize the segment of the bone that is slipping forward. We open up the nerves and we stabilize the spine using screws or cages. So this surgery normally takes around 2 hours. It can be done through open procedure, through microscopic, as well as through minimally invasive technique. And normally the patient is required to stay in the hospital for 3 days. So if you are suffering from spondylolisthesis, don't wait. Consult a doctor or consult your spine surgeon, and he will advise you based on your symptoms and the extent of slip that if surgery is required, what kind of surgery is preferred. Thank you.